Good evening, everyone, and I'm going to present the primary eye care through IT-enabled vision centers. This presentation focuses on the key components that makes a vision center effective, efficient, and reach its goal of ensuring eye care for everyone. In this presentation, we are going to see what are the key operational components that contributes to the successful running of a vision center. This covers criteria to consider the locations, functioning of vision centers, service delivery at vision centers, support systems to run VCs effectively, training of human resources, and technology for patient care and running vision centers. Location for vision center. As a goal, a location which is 50 kilometers away from the hospital to be chosen in the initial stage of setting up VCs so that the referral management, on-site visit, support and close monitoring in the initial days are possible. Prefer locations where there is no other eye care provider. Locate VCs in town panchayats or at block headquarters so that there will be provisions for the rural people to access these locations. Base town or village with a population of at least 10,000 and covering 50,000 to 60,000 population in 10-kilometer radius would be an appropriate choice. While choosing sites, prefer the ground floor of the building along with the basic amenities, for example, closets, so that it is easy for the old age people to access. Internet connectivity is a mandate nowadays for teleconsultation, sharing of records, reports, and attending meetings with the base hospital. As the location is identified, the demographic details will be collected, which includes schools, physicians, grassroots organizations, primary health centers run by government, and medical shops. All these details were used to build awareness and conduct specific programs. While the initial campaign done for the inauguration, the ongoing demand generation will be through word of mouth to the satisfied patients, diabetic screening, school eye health programs, and also to conduct health education programs in the uncovered areas. From our experience, human resources are backbones for the vision centers. The quality of the vision technician, beside the qualification to examine patients, includes interest to work with the community they live, following the organizational values while staying away from the hospital, and the willingness to learn. A work experience in the base hospital will also ensure this and also helps in maintaining good relationship with the various support departments who helps in operations of the vision centers. VCs by principle should be designed to fully available to the community and hence to be operated on all working days of a week. This helps patients understand its permanency to access the services as per their convenience and also increase the footfalls. While deciding on equipments, it facilitates the comprehensive eye examination and should be of good quality, requiring minimum maintenance as the VCs are not able to afford downtime and are far from the base hospital. VCs should act as an extension of the base hospital, providing the same quality of service but limiting to the primary eye care, providing first aid, eyeglasses delivered, prescriptions for eye problems, and reference with guidance for surgery. The patient flow here you see is registration by vision center coordinator when a patient enters the vision center, and refraction and comprehensive eye examination done by the vision technician. If the patient is a diabetic or 40 and above age group, then they will be undergoing a fundus examination followed by the documentation in the EMR. Further to this, the patient will undergo teleconsultation with the base hospital ophthalmologist, and they follow the prescriptions to get an eyeglass. At the aim at completing the service loop, it is important to keep the services affordable to the local community so that there won't be any barrier. Keeping the review visits free of cost for an episode helps the patient to come for follow-up visits. Providing service locally helps in uptake, solving the problem of the patient, reduces opportunity cost to the patient. Doing so at least 85% of the patients treated at vision centers. This solves problems locally, saves communities' economy, increase the trust and further the demand. Counseling the patient to undergo surgeries, follow-up of patients referring to the base hospital, ensuring compliance is important to complete the service loop. The patient in rural areas deserves all the rights to get the first quality care that is provided in the city, and denying that will be an injustice to them. Hence, exploring and using affordable technology that enhances the quality of care is a timely requirement. While this is an ongoing process, some of them that we found to be more beneficial to the patient and the organization are deploying electronic medical records which ensure documentation and available for future reference. It also helps the vision center to follow up on chronic eye conditions and keep the environment green. Teleconsultation ensures ophthalmologist interaction with the patient, and it increases the trust and quality. Fundus imaging helps in early diagnosis of chronic conditions and prevent blindness, helps the patient stay productive to the society. I'm sharing the average workload of a vision center based on the recent data 2019-20. Aravind Vision Center's average is 30 OPD per day with the lowest of 15 OP per day. When it comes to cataract surgery, at least 1 or 2 patients advised per day, and overall in a year, they have performed 310 surgeries per vision center. When it comes to opticals, 3 to 4 eyeglasses were delivered for correcting refractive errors in a day, which comes to 85% uptake, and in a year it counts to 1,160 eyeglasses per vision center. Similarly, 50 to 60% of the outpatients may need a medicine prescription to correct minor ailments, and 7% of the patients who visit vision center need base hospital referral for further examination. When it comes to sustainability, the major investments were through internal support or external funding. The operational expenditure will be made through reaching more people, increasing the uptake of services, which includes the eyeglasses, cataract surgery. The model become financially viable by the end of 2 years for its operations. What a VC expect from a base hospital? It needs a coach or a guardian who is available full-time to support on demand generation, track the vision centers on day-to-day basis, and respond to the referrals from the vision center to provide feedback on the quality of care given at vision center, patient-centered care, performance, and also to ensure the coverage from vision centers. Managing human resources, which includes providing leaves, alternative postings, continuous training for the vision center staff, and also handling local issues. When it comes to supplies, it's very important support that is given by the base hospital to ensure the adequate amount of supplies available in the vision center, and periodic replenishment to be done as and when required. Maintenance of equipments is an important support from the base hospital, and managing infrastructure in terms of painting, cleaning, and also payment of tariffs like monthly rent, electricity, and then internet connectivity should be done from the base hospital, and the burden should be away from vision center. In addition to this, ongoing continuous medical education should be done in coordination with the base hospital. To summarize, the mindset for providing comprehensive eye care should be there. The HR should be oriented for the purpose and adequate training. Continuous efforts to be made to complete the service loop for the patients who visit vision center, and by overcoming the challenges, adopting the appropriate technology that supports patient care as and when it required, and then continuous monitoring and improvement. All should be done with the good leadership drive. Aravind internally scaled to 80 locations over a period of 15 years to reach a population of 6.9 million. And while developing its own vision center, Aravind parallelly shared its experience and handhold several states of India and Bangladesh to set up their vision centers. Thank you. Now, let us hear from Dr. Ghulam Mustafa, Director, National Eye Care Bangladesh, who is instrumental to set up vision centers for the government of Bangladesh.
Dear friends, I am Dr. Ghulam Mustafa, Director, National Institute of Ophthalmology, Bangladesh, which is the apex institute of ophthalmology in Bangladesh. As you know, Bangladesh is one of the densely populated country in South Asia with 170 million population. Eye care services are provided by government and NGO, but still the reach is inadequate. In 2017, with the support of Aurobindo, National Eye Care envisioned telemedicine-supported community vision center as a solution to deliver comprehensive eye care services to the rural population. They helped us in defining the scope of primary eye care, ideas for setting up vision centers, putting in place support systems, developing curriculum for training, etc. Aurobindo helped us to establish the vision centers. Their regular interaction with the team and on-site support helped us to make it possible. We now have scaled up to 50 centers and were able to reach 12 million population through them. We are in the process of setting up 40 more to ensure eye care for another 10 million. I sincerely appreciate LAICO and Aurobindo Eye Care Systems guidance and support in making primary eye care to the rural population of Bangladesh. Thank you very much.